Welcome to the Journal Club, an online program developed by Clinical Liver Disease, the multimedia journal for the American Association for the Study of Liver Disease. My name is Steve Scaglione from Loyola University Medical Center. Today, I'm honored to be joined by Dr. Don Jensen, currently Professor of Medicine at Rush University in Chicago, previous Director of the Center for Liver Diseases at the University of Chicago for over 10 years. Dr. Jensen has authored over 100 publications, served as editor in various roles on well over 10 liver-related journals, including hepatology, and has been awarded many teaching and mentorship awards throughout his career. This November, he is being awarded the Distinguished Service Award from the American Association for the Study of Liver Disease. Today's topic is how to review an originally published article. Dr. Jensen, welcome.
Thank you, Steve. It's a pleasure to be here.
So before we begin and getting into the nuts and bolts of a journal article, what journals do you read?
Yeah, you know, it's a great question because we all know that there's a million journals out there, right? So you can't read everything in every journal. So my goal is I want to highlight those articles that I don't want to miss, right? So I do a Google search for certain topics, hepatitis C and a cirrhosis topic, and so I might see articles that I might otherwise miss by looking at the mainstream journals. But the ones that I look at pretty consistently are the New England Journal, Annals of Internal Medicine, Hepatology, our journal, Gastroenterology, Clinical GastroHep, and Journal of Hepatology, the EASL journal. So those are 6 that I try not to miss. I just look at the table of contents. I don't read every article in those, but at least I try to pick up important articles in those particular journals. And then I'll dig down and mostly look at our journal, Hepatology, because I think that's where a lot of the fruit really lies.
You touched on this a bit, but when you pick up a journal, and how do you decide what to read and ultimately in your busy day when to read? And for example, if a new issue of Hepatology comes out, how do you prioritize the articles? It doesn't sound like you read it cover to cover, but do you read the summary at the beginning? Do you look for review articles or just new original research in a topic you are interested in? What is your general approach?
Yeah, let me take when I read, because I think it's important that we establish sort of a time when you can read and not be distracted by a million other things, right? So for me, that time is early morning. So I get up early, I work out early, I do a run, and then usually when I come back, I'll have about maybe 45 minutes or so. I might be having coffee, sometimes reading the newspaper, but I'll try and look at the journal, maybe read through a couple of articles at that time. Usually it's quiet, my phone's not ringing, my pager's not going off. So I think that time is important. And I think it's important that you have a time that you set aside, you know, for reading journals. There was a professor at Rush years ago, and I remember him. His name was David Baldwin, and he would go to Massachusetts every summer for a month. He would take a month off, go to Massachusetts, and he would take a stack of journals with him, or articles that he ripped out of journals in those days. And he spent 2 weeks out of those 4 weeks doing nothing but sitting by the ocean and in Nantucket and just reading journal articles, and he was as happy as a clam doing that. And I thought, you know, that's a cool way to do it. You know, take him on vacation if that's what you want to do on your vacation. Anyway, but it worked for him. So when I pick up a journal, say hepatology, and a new journal comes and I look at it, so that there's a couple of things I look at right away. So one thing is I do look at the editorials. I want to see. I go through the table of contents, of course, but then I'll look to see what articles did the editorial board feel were the most impactful and important for that particular journal. So I think those you don't want to miss, reading those that have an editorial associated with it.
Got it.
Then I look at those areas, the review articles. Is there a review article? And if it's a review article, is it something I'm interested in or something that I think I should maybe set aside to read later? And then I'll go through the table of contents and I'll look at articles, ones first some of those that are in my field, the hepatitis field that I'm interested in, and then I'll look at other articles along the way. I don't necessarily read the articles in that order, but I want to see what's there to get to know how I want to use my time. So that's sort of my general approach when I look at it. I also look at hepatology elsewhere, where they highlight articles that are published in other journals that the editors have decided should be highlighted in hepatology. So I look at those as well. So that's my first scan through when I open up the journal. That's how I sort of think about it and prioritize the articles that I'm going to read.
What about topics outside your comfort zone? How do you feel about things like bile duct physiology, genetics, and how do you approach those?
You know, I think that's a struggle for a lot of people, and it's a struggle for me that's not a basic scientist. But I also feel that every month I try to pick one article that's outside my comfort zone. And I think your comfort zone, I think that's a proper way to really phrase it. Because I think the future of medicine is getting more and more technologic. And if you only stay in your comfort zone, you only stay in those areas that you feel very comfortable with, you're not going to be as adept at picking up this new technology and the new science that's going to be out there. So those that are genetics and those articles on bile salt physiology and other things, I think I try to pick one to really go into some depth each month.
Great. And so, okay, now you've picked an article you want to read, and how do you approach that individual article? Like, do you read it from abstract through discussion, or do you tend to skip around?
So I do skip around a little bit, and it depends. It depends on what that article is that I'm going to read. So one of the things I first do is if it's an article that's in my wheelhouse. So if it's a hepatitis article, for example, the first thing I'll do is actually look at the masthead. I'll look at the authors. Do I know the authors? Usually I should, or have some familiarity with the authors. Is it NIH funded? Is it industry funded? Who's doing the funding? Is it a single center? Is it multi-center? So a lot of times before I even look at the rest of the article, you can get a lot with that 30-second scan of the masthead to see who's written this particular article. Then I'll go to the abstract and I'll read the abstract, and I'll read the abstract fairly carefully at first, and then I'll skip to the last page to the conclusion of the paper, because I want to see, based on this abstract, where did this manuscript actually end up? What did they say they found? I think for me, and everybody's different on this, for me, that helps me then focus as I go through the paper, knowing this is what they think they found at the end. So that's my first take, and then I do go through the introduction, the materials and methods, and the results, et cetera.
Great. And so you want to see how they take you through the story that they're trying to present.
Yeah, I think it's important. Yeah, I think that's an important part of it, because it draws you in, right? So the abstract and the introduction should draw you into that particular study, that particular science that they're doing. There are some papers that I may just scan the abstract and may just look at the introduction, at the conclusion rather, and may not read anything more than that if it's not something I'm particularly interested in, because I don't have time. The typical hepatology, or I think this month's hepatology journal, I sort of counted up, there were 37 papers that you could read. Yeah. You know, between the reviews and the papers and the hepatology elsewhere, there were 37 different things you could read. It's hard to have the time to do that, but I want to have some familiarity with what's in that particular issue. So I'll at least look at the abstract and sort of the conclusion at the end to sort of log that into my brain that I've seen it somewhere.
Yeah, in many ways, the 37 articles is encouraging, right? Because it's a high impact journal and there's a lot of great publications going on through it. So pushing the science forward from a busy clinician standpoint, it can be encouraging, trying to stay up, or discouraging, sorry, trying to stay up to date on the best science. But this is why I think we're, you know, this, your approach is particularly useful. So when you look at an abstract, you know, you mentioned you starting with the abstract. What do you look for in an abstract to say this is well written? It really catches my interest.
Well, the abstract should be a concise abstract of the study, right? I mean, that's the term abstract and what it's for. And we sometimes think of abstracts as an abstract of a paper that's published, and we also think of abstracts that we submit for meetings, right?
Right.
And really, those two should both tell the same sort of thing. Sort of a brief introduction to the background, why this study was done, a brief review of the results, the high points of the results, not everything, and then sort of a concluding statement about what they sort of why they what they found and the significance. I think that should be in an abstract, and the abstract should flow. You should be able to read it and not be inundated by so much data that it becomes that your eyes glaze over and your mind gets bogged down in sort of the numbers and the statistics and stuff. So the abstract should be a constellation of the article, but it should be relatively brief, relatively concise, and well written. And I think a well-written abstract is it's a good teaching point for fellows and residents, because if you can write a concise, well-written abstract, it's much more likely to get accepted for a meeting, for example, and it's much more likely to have a reviewer look favorably at the rest of that article because it's the first thing the reviewer is going to read if you're submitting a manuscript. If it's poorly written, if it's logged in too much data, then if I'm a reviewer, I'm turned off immediately, and I said, oh, the rest of this article is going to be going to be terrible to get through because it's going to be poorly written just like this.
Yeah, that's great. So moving down from the abstract, what points are you looking for in a well-written introduction? Is it important that the introduction outline the hypothesis, the specific aims of the article?
Yeah, I think the introduction is sort of the lead in to the story, right? And I sort of think of the introduction as sort of a newspaper article, the way a well-written newspaper article should flow. It should give the background, why this study was felt to be important, what was the need out there to do this particular study, what are the specific aims of the study, and how will it be developed in a story form, in a story fashion. So I think the introduction is very, very important. The background is important in the introduction because not everybody is very familiar with the field necessarily. So I think having a well-written chronology of the background that leads into this study, what was not done that led to this study being necessary, all of those things should be in that introduction, but it shouldn't be 2 pages long, right? I think all of us think a well-written introduction should be like 3 paragraphs, now maybe more in a very technical article, but roughly 2 or 3 paragraphs for a clinical article should be sufficient for an introduction.
I also think that there should be a statement, getting to what you just said, saying there is a gap in the knowledge in this particular area, and then therefore we aim to do this. And so identifying where this study might be filling in those gaps.
And because you're going to come back to that at the conclusion, at the discussion, right? Yeah. So you want to lead them into the paper, lead them into the methods and the results section, saying, okay, this is what I need to look for in this paper because this is what they set out to prove, right? So I think it's important. I agree.
Moving into the methods section, how important is the methods section in terms of your scanning it versus reading it really thoroughly? And what aspects of the materials and methods are you looking for? And then lastly, are there items or points in the methods section that are essential so that if it's left out, you're rather concerned about the validity of the results?
Yeah, I think it's important. And I think the methods section, you might look differently whether you're a basic scientist and looking at a basic science article. And there you'd want the methods section to be so well written that someone could go in and reproduce that science themselves, or some other laboratory could do it. It should be detailed enough that someone else, or referenced well enough that someone else can go in and redo that particular study. And I'm sometimes bothered by where there's little detail or reference to an obscure manuscript where it's very difficult to go back and tease out the methodology in that particular study. So I think that's for the scientific side of it important. For the more clinical studies, I want to see, if it's a patient-centered study, what's the patient population? that they're using? And does this population, what are the inclusion-exclusion criteria that they've used? And does this represent the population that I see? Or are they really cherry picking, you know, a more idealized group of patients that don't necessarily reflect the garden variety that I see in clinical practice? So I'm looking at inclusion-exclusion criteria for that regard. So I think in that sense, I think the materials and methods is important. What are the statistical methods they use? Now, I don't often know all of the statistical science that's used, particularly some of the newer ones that are used that I might not be familiar with. But I want to know that they reference that well, and that I could always go look that up if I needed to. When I am reviewing papers for journals, that becomes a very important part. If I don't understand the statistical methods that they've used, I will ask a statistician, who every journal has an associated statistician, is this the appropriate statistics to use in this kind of study? But I think all of us should gain some knowledge of statistics, you know, and part of reading these papers is you sort of gain a frame of reference for what statistical methods are more commonly used in what kinds of studies.
Great. And when you move on to the results section, how do you prefer it to be displayed? Do you like it more text or less text? Do you like more charts, figures, or graphs? What really do you look for in this section?
Well, I'm sort of a visual person, so I look at tables and graphs. I mean, that's the first thing I look at. It doesn't mean I don't read the results section, but I'm looking at the tables and graphs, and I'm looking to see whether they're depicted in an appropriate way, because you can make a table or graph anyway look a little misleading depending on what the axes are in that particular representation. So, but I'm looking at that, and I know from the methods and the introduction what they're looking at. And before I've read any of the methods, I mean the results or the discussion, I want to know, how would I conclude the results of this study looking at that data myself without reading how they've interpreted it. And I think a good study, it should be pretty intuitive what the results will be from looking at that graph and those tables. So that's one of the things. I also look to see that the numbers match up. And I can't tell you the number of papers that both I've read and reviewed where the numbers in the tables don't really match up with the numbers in the materials and methods section.
Yeah.
You know, they might say 179 patients, but in the results section, it'll add up to 178. And you're going to say, well, why is that 178 and it was 178? And then you're digging through this stuff and getting aggravated to find out where that other patient is. So I look at the numbers, do they add up? So those are the big take-home points. Part of it's a little teasy, but I think it's important, particularly if you're reviewing a paper.
And when you move on to the discussion section, you've reviewed the results, the background, the methods. What are you looking for in a very well-written discussion?
Well, I think the key is what you just said, well-written, right? So the discussion shouldn't just be a recapitulation of the results again. So it should be continuing the story from the introduction. So someone should be able to read the introduction and then read the discussion and have the story flow. And the first part of the discussion should be a recapitulation of what the key points of the results were. Not every single part of it, but the key points that were discovered in the results section should be the first part of the discussion. And then that should tie into, how does this tie into the field in general, and how does it fit this need that was pointed out in the introduction? How does it answer the question that they as their specific aim? And then one of the things, and I know we're going to talk about this, what were the limitations of this study? And not all studies do, and I think we should probably focus on that because it's an important part. And then finally, the conclusion. How does this tie in? What's the concluding statement for this particular study, and what are the future directions that would be indicated based on these results?
Yeah, getting to the limitation section, do you think in many research studies that you've written, journal articles that you've read, not written, but journal articles you've read, that the limitations and the shortcomings paragraph is kind of given a little bit too little attention, or a little short shrift? How do you feel about the limitation section?
You know, I think it's very important. I think if you're an honest scientist, um, I think it's important that we think in terms of what are the limitations of our study. And I think it's something that's difficult for authors, particularly younger authors, to put out and lay it out on the table. What are the limitations? And I think some subliminally feel, well, that's the problem for the reviewer, and that's the problem for the reader to sort of sort out. But I think a good author or a high quality scientist will say, okay, these are the limitations of this study. You know, we didn't have enough patients, not as many patients as we thought we were going to have. Or we had too few in this arm that had a problem, or too many that had a problem, or whatever. And I think if you lay that out, I think it gives more credibility to the science that you're presenting. So I think it's very important. And if I'm a reviewer and that hasn't been laid out in the discussion, I'm going to point it out to the authors and make sure that they do add more in terms of limitations in their discussion. I think it's a big part of being a reviewer is to point out those shortcomings. So
Yeah,
yeah,
I think it also allows the reader to not draw conclusions from the data that are not there. To have the reader assess, yes, okay, this is interesting data, and but there are limitations, and therefore I have to be careful with the results and not right away apply it if that's applicable.
yeah, no, I think that's all true. I think that's what you want out of a study is for someone to say, is this applicable or not applicable? What are the limitations? And it was just, so we talked about the patient population. And one of the limitations might be, well, we took a very select group of patients for this study because we didn't want patients with other comorbidities influencing the results. So then I know, okay, this is sort of a cherry pick study. It's not going to reflect all the patients I see. That's a limitation that needs to be further discussed in the discussion.
And the reference section, do you take a look at that, or do you skip it?
No, I look at it carefully, and because I'm looking for two things. One, in my field, I'm looking to see whether key references are missing, right? So I want to know, why didn't they include this study that was impactful or important in reference to the study that's being published. The second thing I'm looking at is the dates of the references.
Mm.
What's the most current reference listed there? And if that most current reference is 2 years ago or 2.5 years ago, then I'm wondering, how long has it been since this paper was written? How many different journals have rejected this along the way to have it be so long from the final manuscript to publication? Normally, that should be about 6 to 9 months from the final revised manuscript to publication. And so if it's much longer than that, 1.5 years or so, then I worry about how much of this is dated information, or how many times it's been rejected before it got published.
So you were touching on this earlier about reviewing an article for publication rather than an article that has been published. So in addition to what you've already stated, how does your approach change if you are reviewing an article for publication, for a journal?
So as a reviewer for a journal, and I think it's a good experience for really all of us in academic medicine to review articles for journals. I think there's a real need for high quality reviewers to review articles. So I think one, that's important. I think what I do when I'm looking at an article for possible publication is I'm thinking, what does the editor want? The editor wants to know from me, is this article impactful enough to change the field? Is this going to have an impact on the field? Are people going to read it? And will this lead to further advances in science? So that impact factor of the article is sort of the first thing that you want to sort of capture. The second thing I want to know is, is it going to be scientifically valid information? So reviewing it, and I review it much more closely than I'm reading it for just my own general information, the numbers have to match up. The references have to be recent. There can't be something left out. What are those limitations? And that becomes a big part of that review. And part of reviewing it is that I send a bulleted commentary to the author saying, would you please comment on this, on this, on this, on this, and elaborate here, or why didn't you do this? So that I can gain a better feel for that particular article. And that then the author has to answer those queries and return that article to me then to re-review a second time. And then I finally give a final recommendation to the editor. And I think, I'm not sure what the current acceptance rate for hepatology is right now. I think when I was associate editor, it was somewhere around 20, 25%. So that means a lot of good articles are not getting published. Or they're being suggested to another journal like liver transplantation or one of the other journals that are in the family. So yeah, it's a hard job. You don't get paid for it. It takes probably, I'm guessing I put in about 2 hours of time to review an article for a journal and do a good job with it. So, but I think I learn a lot in the process. I learn more in the process doing that than I do reading an article on my own.
It's important information. And so let's say for a very busy clinical hepatologist, how do you know if an original research article should change your practice patterns? Or how do you advise clinicians to take a clinical research article they've read recently and apply it to the clinic that very day?
So let's divide this into two types of articles, right? So one type of article is sort of the first of its kind, right? Comes out of the blue. This is a new therapy. And I'll give the example of hydroxychloroquine for COVID-19, right? So hydroxychloroquine, this is on 10 patients in France, had hydroxychloroquine, 9 of them survived. Is hydroxychloroquine therefore ready for prime time? And although a lot of us made the mistake of accepting that, but that would not be the kind of new science you would want to apply to your practice at that time. Most new things like that require reaffirming data, larger populations, more diverse patient populations, greater diversity in age. So I think we're looking for the more larger multi-center type of clinical trial before we then apply that for clinical use. The other side, the other paper, so the answer is no for those. Okay. But the paper that's the phase 3 multi-center trial of 2-drug combination for hepatitis C on 3,000 patients, that's been through numerous iterations in phase 2, I think that you can apply, right? Because that study is probably not going to be redone. I mean, if you have a 3,000 patient population of the patients that you think are appropriate for this particular study, that I'll apply. So I think it depends on what the study is that you're reviewing. And a lot of people, particularly junior faculty and interns and residents, I think are enamored of a very recent thing that they read. Right. It says, oh, this looks great. We should do this right now. We should be doing this on our patients. And then you have to take a step back and say, well, has this been done before? Is this the first time you're reading this? Has anybody done this? For all the questions that we just said, I think you have to take a step back a little bit before. I have less concern about a diagnostic study, more concern about a therapeutic study.
Yeah, I agree, and I think that I'm more concerned when they want to push forward with new treatments and an observational study, which gets back to our discussion on limitations section of the discussion, to take that really seriously, right. And to review that section like you would the method section, and so apply it only when you feel comfortable enough with the data. Can you remember in your long career? Can you remember a time by which an original research article changed your career? Or your clinical approach?
Well, I'm old enough that I remember when I was a resident, I think, that the original study from the Mayo Clinic came out on the use of prednisone azathioprine for autoimmune hepatitis, which we didn't even call autoimmune hepatitis then. It was just chronic active hepatitis, but it was autoimmune hepatitis. And that was a single study. There have been a few previous ones on steroids and autoimmune, but it was a well done, well designed clinical trial that really changed behavior, that immediately changed behavior. I can think of the Madri steroids in alcoholic hepatitis article.
Sure.
Now there were a few previous ones on steroids and alcoholic hepatitis, but the Madri paper, the original Madri paper from Jefferson, I think, was, I think, something that really changed practice. And we had then the discriminant function as a way of sort of deciding which patients should and shouldn't get this therapy. So that was a paper that changed therapy. So there's been several of those. And in hepatitis, there's interferon, ribavirin, we went through that whole arc of therapies before we came to all oral treatment. But those are the ones that stand out, I think, in my mind. They're the ones that really change things overnight.
In general, how has original research articles and research in general changed from the beginning of your career to now? It's a big question. And then what are you excited about in the future?
Yeah. So I think, 40 years ago, 35 years ago, we didn't have the technology, right? So the papers were less heavily influenced by technology. They were more observational, large populations of patients, and here's the natural history of this particular population of patients, and some therapeutic advances, like we mentioned, with steroids and alcoholic hepatitis or autoimmune hepatitis, et cetera. But I think what's changed over the years is the technology, is the science. So now it's hard to do an observational study or natural history study without incorporating more science into it. Not that you can't do it, but I think they're not as often published as the highly scientifically rigorous studies are. So I think that's been the big change. I think that just the technology, just the genetics, the PCRs, all of that has changed how we look at medicine.
And in the future, what things are you particularly excited about?
Well, I think it's going to be more in terms of the genetics, right? So I think we've uncovered that that we talk about precision medicine, narrowing down to be more focused, and I think that's going to be a bigger and bigger part of what we do in the future, is finding subgroups of patients, subgroups of diseases that respond differently, instead of saying, well, all alcoholic hepatitis responds to this therapy, or all patients with hepatocellular carcinoma should be treated this way. I think we're going to be subdividing more and more based on genetics and other aspects of those diseases. So I think the exciting part will be using that knowledge of the gene to really advance how we treat patients in the future.
Great. And so looking at your career from the beginning, and you've been incredibly successful throughout your career and very productive. Now, a lot of our viewers and readers are young trainees or early career attendings. What advice do you have for them about productivity? So in other words, what is Dr. Jensen's production function? And one other question I was going to add into that is, how do you prioritize when to write? And do you have any advice about writing in general?
Yeah, I think over the course, there's groups of residents and fellows that are very good writers, and I think for them it's easier to start doing a manuscript preparation. I think there's others where that's not a natural ability, and they struggle. They might be good at the science, but they struggle putting it on paper. They struggle writing it up. I was a little that way when I was a resident. I was a little more, it was a little more cumbersome for me to actually write a manuscript than it was to actually do the science. So I think that's part of it. What I tell our fellows right now is that you should sort of focus on trying to think of getting 2 publications a year. Now, why two publications? I think if one is like a case report and the other might be a review article, or I don't care what it is. It doesn't have to be basic science. It doesn't have to be translational research. But I think having gone through the process of submitting an article, getting it accepted, reviewing it again, revising it, sending it back in, and then you get that positive feedback of having your name in print, of contributing to the science, I think is such important feedback for their career to go on.
Yeah.
If you're waiting for that blockbuster study and you're not going to do anything until you get some blockbuster study that some senior attending is going to drop in your lap, then that's not the right approach. I think even case reports, anything that you get published in your name, I think is a good thing and is positive. So that's the biggest information that I could give back to fellows. I think I see people who they do a clinical study, they might want to review 150 patients, and we just did this recently at Rush. Had a resident looking at 150 patients who had severe thrombocytopenia, cirrhosis and severe thrombocytopenia, less than 50,000 and less than 25,000. And we went through all of this data, and at the end, there was a part that he neglected to survey. And so one of the things, when you're putting together, and it sort of inhibited his ability to write up this manuscript, right? Because he said, oh, this is going to be a big problem. This is sort of the limitation thing we were talking about. So what I think is if you're putting together a database of a lot of patients, I tell the fellows or residents, stop after 10 or 20 patients. Don't collect all the information on all of the patients that you want to do. Stop after 10 or 20. Think about how you would write this up based on what information you've gleaned from those 20 patients, for example, because then you're going to find where the holes are. So, did you miss not collecting samples or not looking at data on sepsis, for example, in your group of patients? Before you get everything in, if you get all 150 patients and then you have to go back and add, or it's just a big nightmare to do. So stop early, think about how the manuscript is going to look, and then finish completing that data set. I think that's probably the other important, because I've seen so many people just suffer, after they put so much work in, yes, and then they realize there's a hole in it. And part of our job as mentors is to find that hole early, but also I think writing it up early as a draft is probably not a bad habit to get into before you then go to the final draft.
It's a great point.
Yeah.
Go ahead. No,
and I think some people just have analysis by paralysis, right?
Yeah.
So they have all that data,
mm-hmm,
and then I don't know what to do with this. I don't know, is this related to this? And do I do statistics on everything? And so I think there's just so much data that they become paralyzed with all that data.
I think sometimes two things. I think stopping after 10 to 20 patients is excellent, because not only for the reasons you identify, are they missing something, another variable, but have they really defined their variables they're looking at appropriately? Because they may not be, and then they can go back just on the 10 to 20 rather than the 150. And so that's excellent advice. On behalf of clinical liver disease and the ASLD, thank you, Dr. Jensen, for your very practical and very insightful wisdom on how to review a journal article. For those of you who are watching, we hope you found this episode of the Journal Club useful and can apply the key takeaways directly to your day-to-day work. For information about clinical liver disease, please visit us at www.cldlearning.com. Thank you for watching.
Thank you, Steve.